Hello, everybody. I am so sorry I got us delayed, but we're going to talk today about a wonderful topic called homeopathy in surgery. And before I did that, I wanted to get feedback from you folks. Who has been in surgery recently in the last few years? And what have your experiences been like with pre-surgery, during surgery, and post-surgery? Would anyone like to share their experiences? I will start with mine, and then we will go around the room. The only surgery or sort of surgery I have had in my life was my pregnancies, I suppose, which is not really surgery, but I got an episiotomy, which is your vaginal opening gets cut in order to let the baby out. It was completely unnecessary surgery, and it hurt like hell. For 6 weeks afterwards, I had troubles having bowel movements because I was so terrified. If I had known about homeopathy back then, or if my mom actually was the one knower of homeopathy and done some homeopathics, it would have healed in far less than 6 weeks. Over to you guys. Anyone want to share their surgical experiences? And what would you have liked to have been different?
I had a very positive experience. The surgeries were on my mouth for my teeth. Teeth that I had extracted. One was infected from earlier conditions, and one was a root canal that I had removed. The dentist, who is in Marin and is extremely skillful, used homeopathy. I had certain things that he gave me, as well as Sushma. You gave me some suggestions, which I took. And the operation, or the procedure, was very, very mild, and the recovery was extremely short. It was like a week after each one of those. So
Fantastic.
only things a week or 10 days, but everything about it was very positive, and I was very pleased with having that support, the homeopathic and personal support, and it went very well. And a very caring, very skillful surgeon who did the extractions.
Fantastic. Anybody else? Any experiences you would like to share?
I guess for me, the only thing is my wisdom, some of the wisdom teeth being taken out when I was a teenager, because I haven't had any surgeries either. So,
okay.
And all I remember is the gaps, the holes, and my tongue playing with the dissolving stitches and stuff like that. And then I think the drug that was given to me, I was very loopy, things like that, and maybe throwing up possibly afterwards, after being home. But yeah, that's all I remember.
Shannon, still based on video.
Anyone else? Anyone else want to share?
I had 2 episiotomies, but yeah, I mean, I didn't know homeopathy back then, and for me, it has never healed. I still have issues with my sutures, and the gynac, if I show them, they just tell me there's no issue, but I know that they haven't healed. And yeah, now I sometimes find relief with some of the homeopathy remedies, but for my sister, I had told her to do that spray of hypericum and one more. And I have never asked her how is she, but 1 year down the line, she has never said that she has any issue.
Wonderful.
So probably, that initial stages when there is the lesion done, probably if someone gets help at that time, it helps in healing faster. That's what I feel.
Yep.
That was
Very
not
nice.
there in my case.
Yeah. Anybody else? Any botched surgeries? Any surgeries that failed, or where there were problems, or second surgeries to fix the first surgery?
It's Renee. I had total knee replacement a year ago, and it all went it went fine. It was a good surgeon. There's no problem with it.
Excellent.
What I do have is I have a wound problem, and I'd like to get some information on that one.
Yes, we will talk about that. This one is for you, Renee. All right. Anybody else?
I just have a little addition, which is a little off subject, but when I had the extraction of the old wisdom teeth, which had been removed many, many years ago, and the root canal. There was infection in both of the cases. And when the surgeon did the operation, he showed me the infection, the little particles. So that's just another thing which I'm glad that I did.
Yeah, yeah. Some of them are terrible. They're sitting in your mouth for years on end and infecting the rest of your body. Claudia?
Okay, this might be kind of triggering, but I had a very extremely life-saving surgery, kind of the only medical thing that's ever been negative in my life. And I also had an episiotomy, but it healed okay. But it definitely was uncomfortable and lots of sit spats. When I was 25, I'm 73 now, I had a gynecologist who was doing an experimental type of IUD that was like a little plastic bag on the string instead of the hard wire stuff that they had for the IUDs and still have. And what happened was the ovum implanted on the edge of my fallopian tube instead of going into my womb, which IUDs create like a low-grade infection in the womb. So my ovum then grew into my abdomen. I had an ectopic pregnancy that was several months old, and I almost died. So I was very grateful for the surgery. The worst part of it was when I woke up, the nurse goes, "Oh, here, I'm going to give you a morphine shot so you won't have any pain." And I got so sick. I just went, "Forget it. Don't ever give me another shot." And I mean, it was just the most horrible experience. The morphine was worse than anything else. But of course, I was weak, and I have got like a little very, very low bikini scar that took years to kind of totally reabsorb. You can hardly see it now. But anyway, that was my surgical experience.
All right.
Be alive.
All right. Okay. Anybody else?
I want to add one which happened several years ago. I had cataract surgery on my left eye. So the replacement of the I guess the natural lens with a plastic lens. And I wasn't aware of homeopathy, or at least vaguely aware of it. And had the surgery, trusted the surgeon, and my vision was compromised as a result of the surgery. And so I've been continually learning to live with that and do whatever I can to be okay with it.
Yeah. I have an example. We'll talk about eye surgeries as well.
Okay.
All right. Anybody else?
This is Ann, and I had my tonsils and adenoids out when I was 6. It was
Wow.
a Christmas present from my grandmother for my brother and myself. He was a little younger than me, about 13 months younger, and had a lot of bleeding, had a lot of infections afterward, of course, because they're part of the immune system. They figured that out later. But in the 50s,
Wow.
not everybody had
Mhm.
that. It's very traumatic.
Yeah.
And that's it. I can't have surgery. I'm wildly allergic to all antibiotics and anesthesias.
Lucky you.
So
Lucky you.
I'm here on my own.
I have an experience to relate on my tonsils. I was very young. I had swollen tonsils. My best friend had swollen tonsils. Her mom got hers taken out, and my mom took me to the homeopath in Delhi, Dr. Rastogi, and mine were healed and hers got taken out. And everything that followed. She suffered from acute infections for years thereafter. And I kind of went on with my life.
Mm.
And if you had known about homeopathy back when your adenoids and tonsils got taken out, you would not have recovered and needed surgery. I can guarantee that.
Oh,
Anybody
sure.
else?
Yeah.
Yeah, I have a story about our daughter Mirabai, who had to have wisdom teeth extracted because they were growing horizontally instead of vertically. And she had to take a flight within a week of the surgery. And the dentist was not going to do the surgery because he didn't think she could heal that quickly. But I talked with her, and she talked with her body. And before the surgery, she informed her body that someone was going to do something that might seem like it was invasive, but it's really happening to help her. So she's got to cooperate with it and allow herself to heal with what's being done. And the dentist said he had never seen anyone heal that quickly. And she was able to take her flight. And I just talked with someone last night, someone whose friend had just broken her hip. And so she's having surgery and they're doing, I guess, they're doing the hip surgery and doing the metal pin and so on. And I suggested also that she talk to her body and let her body know ahead of time that the person is not an invasive person as such, but is doing that to help her because that's what she's chosen. And so I just want to let people know it's a good idea to let your body, mind know ahead of time.
That is what Sunshine just said is so unbelievably true. And we'll talk just about that as we go forward. Incredible. You're very intuitive and amazing. That was a brilliant statement. Anybody else? All righty. You guys are a very healthy lot. Okay. Sooner or later, sometime or the other, all of us have had some little form of doctor intervention where a doctor has pulled our teeth or pulled a body part out of our body, or a gallbladder or a uterus or an ovary or a breast or a tumor or what have you. And that is when you go to a doctor, get a surgical intervention, and you pull that part out. Homeopathy is based on the principle that everything that happens to your whole body. And if the problem is inside out, taking that body part out, the broken body part out, and so on, or the tumor out, is really not going to fix the problem. Nevertheless, if it interferes with your breathing or your walking or your talking or your digestion, you got to do what you got to do. You got to do the surgery. And it is for such instances that homeopathy is extremely useful, and it'll prevent preoperatively, it'll prevent exactly this terror that your body suffers from, that you're undergoing some sort of trauma, because your body doesn't know you're going in for a surgery. The body just sees a broken abdomen or an incised or a torn apart limb, or an elbow that where the skin flap got taken out, or the gallbladder that got ripped out of the body. So the body is in trauma, and starting with the spiritual, the mental, and the physical, and applying the laws of similars, you can do a lot to make the surgery go fantastically faster, and more than anything else, prevent after effects. There are people who have NBWS. Anyone know what NBWS is by now?
No.
Never been well since. Never been well since. This happened or that happened. This surgery happened. Since my gallbladder got taken out. Since my tonsils got taken out. Since I got my tubes tied or my uterus got taken out. Never been well since. And homeopathy addresses that very beautifully. We'll be very practical. So let's start right away. And one of the key things, the most important things, is preoperatively how you feed your body. And you all eat these things. None of you are vegans. None of you don't know about the sacred nature of some fat-soluble vitamins that are only present in animal fats. So before surgery, please, please, please prep with a high meat, liver, organ meat, heart, lungs, trachea. If you're going in for eye surgery, eat eyeballs. If you're going in for liver surgery, eat liver. Kidney, same thing. Gallbladder, eat fats. Eat lots of things that'll help you gain the nutrients you need to deal with that surgery. And so food is medicine. You need ferments in your body to prevent infections down the road. You need nourishing foods to help you deal with the trauma of the surgery. and to recover faster. So food is number one. Your attitude and food is number one. And then we come to some fun things that homeopaths around the world have discovered when surgery happens. This is a picture of Jeremy Sher and Camilla Sher, who run a nonprofit called Homeopathy for Health in Africa. You may or may not have heard of them, but they help people with AIDS. And they have had miraculous and magical recoveries in women, especially who get AIDS from their husbands who got them from God knows where. And the women are the primary breadwinners for their families. If they cannot work, the whole family dies. And so these are women with AIDS whose CD4 counts were very, very low. And with homeopathy, they've gone literally from 0, 30 to 800. So it's measurable, it's objective. And so Jeremy and Camilla have worked very closely with local hospitals. And mercifully in South Africa, the local hospitals let them in. They allow complementary treatments. And Camilla went into the hospital and said, look, she went to the surgery ward where serious surgeries were done and said, look, I want you to try this homeopathic remedy, Bellis perennis, which is for soft tissue injuries, like abdominal injuries, muscular and skin injuries and surgeries. And she said, I want you to try this post-operatively on your patients and try it on half the patients and don't try it on half the patients and see the results. And they agreed. The patients post-surgery who had Bellis perennis 1, 2, or 3 times a day got out of the hospital in 3 days with 0 complications. The patients who did not get Bellis were in the hospitals for 7 days, and a lot of them had complications. So the power of homeopathy, the law of similars, is very, very powerful. And what you want to do is minimize the time you spend in healing, minimize the time you spend in dealing with the after effects of surgery, heal from post-surgical complications or avoid post-surgical complications entirely. But you got to use your mind and you got to use the help of someone, a buddy system, a homeopath. You can call me. You guys can call me. I'm your hotline. You can call me on your cell phones during and after surgery to tell what your symptoms are so you can take the appropriate remedy. It'll make all the difference in your surgical procedures. Any questions? No questions. Okay, so we're going to look at surgery in phases. The preoperative phase, which is how do you prepare? A lot of people are told, hey, eat arnica. Well, I have news for you. If you take arnica or phosphorus before surgery or nux vomica, guess what? You will need twice as much anesthesia to knock you out. Because what does arnica do? It puts you back into your body. What does phosphorus do? Nux, they put you back into your body. They antidote the effect of the drugs. So you never want to do that. So you got to use your mind when you use homeopathic remedies, because just as they work, they can be very harmful if used improperly. But the good news is it's very simple for a common person like you and me to use homeopathic remedies safely, effectively, and properly. And the PPP stands for something. Does anyone remember from prior presentations what PPP stands for?
No.
Okay, it stands for proper prior preparation to prevent piss poor performance. So remember that. Don't rush into surgery. Sit down with a buddy. Watch this video, which will be posted on Rumble, not also on YouTube, but I keep getting taken down. And prepare for your surgery. Prior proper preparation will prevent a very poor performance afterwards. and prior proper preparation will give you great healing powers. So there's the pre-op phase where you plan, and I'm going to talk about that at the very end. Then there's the post-operative period, 24 hours after surgery. You're woozy, you're in pain, excruciating pain sometimes. You know, you might have constipation or diarrhea, or you might have breathing troubles. You're just supine, enervated, you don't have energy, you're terrified, all of those things. Then comes the post-op 3 to 4 day period after your surgery. Then comes the 10 to 15 days after your surgery. And then there's the long term. And we'll talk about something called NBWS, never been well since. Don't regret it. You just got to do it. The problem, the trick with homeopathy is it's so natural. You feel like you got well on your own. You feel so well the day after surgery or the 2 days after, and you're hopping and skipping and jumping about. You don't attribute it to your homeopathic remedies. You just get better faster. But if you don't do it, many people have lived to regret it. So I would say obey the law of similars, and there's nothing as powerful as homeopathy in surgery. All righty. So it's now, let's talk a little bit about right after operations, right after surgeries. You want to reduce your infections. A lot of surgical wounds get infected. A lot of people get, how many people have gotten C. difficile at hospitals? Or Pseudomonas aeruginosa, the multiple drug-resistant bacteria. You get infected. Your wounds get infected. They leave swabs in or whatever, or interns are sewing you back up and you have infections. And so there's a lot of very good treatments to prevent infections, pain and bruising, wound repair, a wound that takes. So this is your body telling you that you have trauma and wound, and it's trying to heal that wound. And what helps with wound repair a lot is a homeopathic intervention.
Question.
Yep.
I've read, I don't know anything personal, but surgeons who have done operations and who've left surgical instruments or gauze or anything else in the body.
Yes.
And I would think that homeopathy would be a secondary approach to it, but so you'd have to have a check and see, is there something else in there that shouldn't be there?
Absolutely. That's a very good point. Homeopathy can make symptoms better, but if there's a maintaining cause, such as a lancet or a cotton swab left in your body, you're going to keep getting infections more and more severe. And so homeopathy is not a substitute for a maintaining cause, and neither is food. Very good point. So you've got trauma, you've got an incision where they went in to get your organ or body part out or to operate. You've got pain and bruising. People have had head surgeries for cancers in the head, and they break open your skull, and there's a lot of wound repair, pain and bruising, tiredness, ennui. Then the fourth thing that happens is if a surgical wound has not properly healed, or if the body gets confused, then the body lays down scar tissue and adhesions. And these affect the operation of your meridians. You have these meridians, electrical systems that go around your body, and they require a clean surface for electricity to flow through them, give you the quantum signals you need to feel pain, warmth, cold, sensation, and so on. And so scarring and adhesions, very important to prevent.
Question?
Mm-hmm.
The electrical signals or the pathways, are they the same, or are you talking about the ones that in Chinese medicine are talked about as those pathways?
Those are one and the same thing. 5,000 years ago, the Chinese discovered the meridians, and now when they look at the voltages, they're exactly in those same pathways, with nodes in the center. The teeth are one meridian. Then all the cultures, the prana chakra, the head chakra, the heart chakra, and all these are meridians where electrical impulses congregate and flow through to the rest of your body. Yes. And anytime you have surgical scars, adhesions, wounds that have not healed properly, you're going to have troubles. You're going to have troubles. Or something that prevents electrical impulses from traveling properly.
So,
So,
excuse me, another question. I haven't had the experiences you're talking about where there's continued soreness or aching or whatever. But if there is, how does one know if, the gauze has been left in or the circuit is being blocked? How does one know that? I mean, with the guide of a homeopath or someone else?
you will have symptoms. If you have left something in there, you will guaranteed have some sort of sepsis, a blood infection. Your white blood cells will go up dramatically. You will show up as infection positive. And at that time, hopefully, your doctor should test your blood, order an MRI or CT if he suspects an instrument left behind, and you have to advocate for yourself. They cannot fill you up with antibiotics and say, okay, let's try them. If that doesn't work, we will do an MRI or CT or whatever it is. You will know pretty early on because the symptoms of each of these things are pretty unique
Thank you.
as to what they are.
I have a question.
Mhm.
Regarding the wound scarring, not because like a keloid or something. So again, the electrical signal, the pathway is interrupted. So how does one bring about, that pathway, like loosen the track or allow the electrical signals to flow? So something needs to be done to that scar, right?
Absolutely, absolutely. That's why
So sorry. Yeah, go ahead. I'm sorry.
deep tissue massage, rolfing, massaging to
Mhm.
get the adhesions off is very important, especially if you have not used homeopathy to heal it well in the first place.
Okay, but then even if homeopathy with this, but it's a very long-term program. We can't get results immediately. It has to be done. The frequency should be high. Like even if we're talking about movement or moving
Yes.
that fascia as well as that tissue. So it's a long-term treatment program. It can't happen quickly because it's now chronic, right?
Well, it can become chronic if it's not addressed immediately. So if you see that scar, if it is left to its own devices, it's suppurating, getting pus, then the body gets confused, it's laying down scar tissue there, and before you know it, you now have scarring. And doing things after the fact is very, very difficult. Like when I got gored by the cow, I had scar tissue there and I would massage it. I took thiocyanamide and it's mostly gone. But man, there was scar tissue there on the inside. And part of the issue is if you have surgery, you will have, in many cases, scar tissue, like an episiotomy gone bad. You're going to have scar tissue. It's always going to hurt, never been well since, if not taken care of in the early going.
Yeah.
So what's the prognosis if it's like a long term, like 10 years old or something? Does it get better or it's the same like?
It will get better if you apply the right remedies, not as better as it would if you applied, say, thiocyanamide immediately after surgery, which will prevent and reduce adhesions and scarring and low potency. But definitely any kind of bruising, Staphylococcus aureus will help with the wound healing, or the pain at the site of the wound. A knife-like pain still exists for many people. Arnica, if it was a traumatic injury, wound from a traumatic injury. Ledum, if it was a puncture wound. Laparoscopic surgeries frequently have scarring around them. And you need to take the proper remedy, ledum, thiocyanamide, for the puncture wounds.
Okay.
To prevent problems.
I have one more comment question. I had, just remembering, I had hernia repair on my left side twice. And after the second one, I was visiting a very, very skillful massage therapist. And she said, oh, it looks like scar tissue. It feels like scar tissue. Did you have any work here? And I said, I had hernia repair. And with my permission, over a period of maybe weeks, she massaged it and the scar tissue got smaller and smaller and smaller. So I wasn't aware of homeopathy at that time, but the massage, which as you described for yourself, was extremely helpful.
Absolutely.
Mm.
Absolutely. The body is incredibly intelligent and it does not want stuff lingering around that doesn't need to. And if you give it some help, so some
Mm.
heat, some emollient, deep massaging, over time, the scar tissue. Like if you have blunt trauma in your abdomen, you can have like a big node there for 6 months to 8 months before it all disappears and the body eats it up.
Mm. Okay.
With remedies, it'll be a lot faster and a lot cleaner.
Mhm.
Mm.
And so, what do adhesions do? When you've had surgery, say like this on your belly or in your abdomen, uh, the body, in trying to repair it, gets confused and it over repairs. And it makes connective tissue between, say, your intestines and your skin. And every time you move, you have pain because there are adhesions. These things get stuck to each other. Your organs get stuck to each other. Your skin gets stuck to your muscles. And it's
Yeah.
extremely painful. And so those are the kinds of problems that occur that you want to avoid in long term, post op, by taking proper measures at surgery.
And that's where you're saying homeopathy can help, for instance, to dissolve or break up the adhesions in a positive way.
Exactly, exactly. And heal granulate the wound in the right way.
Great. Thank you.
All right. So now we're going to talk about a botched homeopathic treatment. And this is very important because you want to know what not to do. So this is a wonderful story by a homeopath, Karen Allen, where a patient of hers was doing eye valve surgery for glaucoma. You know how glaucoma, you have high pressure in your aqueous humor. And in order to keep her from going blind, the surgeon recommended that they put a pipe, like a shunt there with a valve at the end so that the fluid could drain out. And if the pressure ever rose, so that her eye would not go blind. And what did she do? Take arnica before surgery or right after surgery. And what does arnica do? What does arnica do?
It relieves the pain and the source of the pain.
Yes, and it heals the wounds. Well, here you've created a hole. You don't want that hole to heal. So as soon as she gave arnica, the valve got healed, granulated over, and got completely closed off, and the surgery was therefore unsuccessful. So please do not take arnica in anticipation of surgery. Do not take arnica if you are going to have a PICC line in your body, because it will get granulated over. Skin will form. That's what arnica does. It heals. The body doesn't know this is a surgical incision and should stay open. It's trying to treat the trauma. So then they said, oops, wrong thing. They reopened it. They put the shunt back in and the valve back in. And this time she did not give arnica. Guess what? The valve stayed open. The whole fluid drained out of her aqueous humor and she was blinded. And so then they said, how do we do it so that there's some scarring there to prevent all the humor from draining, but there's a valve to keep it going? Well, they decided that they would inject some of her own blood into her aqueous humor to raise an immune response, which would raise some scarring because they wanted some scarring. Well, guess what happened? The scarring happened on the inside of the eye and her vision went dark. So these are kinds of, first, let me just tell you, surgery is a last resort. If you can do things without surgery, please do them. And if it's done and done properly, it's a good thing and it'll save lives and eyes. But if it's done improperly and if you take the wrong homeopathics, you can really mess it up. So the scarring happened in the eye went blind. It was like she was looking through a dark cloud. Then they came to her and said, look, we have nothing to lose. We took arnica, then we didn't take arnica. And now first the homeopathic fiasco, then the allopathic fiasco. Please treat. It's a miracle they came to her. They believed in homeopathy. And you can see that homeopathy works from the power of these events. So what she did was she gave this client Cineraria maritima, which is Dusty Miller. And internally, in homeopathic potency, and her vision cleared up, the scar
Hmm.
tissue cleared up, and eventually she gained her full sight back.
Hmm.
The lesson here is arnica is not to be taken before surgery, guys. It's not the panacea for all surgeries. So you've got to figure out your goal and your surgery before you go take homeopathics. Any questions? In order to be super, it's like learning to drive. In order to learn to drive, you have to learn not to crash your car. And it's very simple to do that, but you got to know it. So more is not better in homeopathy, more preemptively.
So arnica is totally contraindicated before surgery.
You should not take it, yeah, because you're not trying to granulate. The surgery is going to create a wound, and there are many surgeries where you want the wound to drain. You want it to suppurate before you apply skin on top of it. And arnica is gonna go Speedy Gonzalez, try and heal your skin over, as will calendula, lacerated wounds. And so you don't want to do that until you have applied the right remedies, until the right stages have happened. So in surgery, you have a knife-like incision. So Staph aureus is the right remedy for that, for your surgical wound to heal from the inside out. And once that is healed, and if there's bruising, then you can apply arnica after surgery, but not before.
So if you've had surgery and you have scar tissue in the eye, and the scar tissue has caused blindness, would arnica help?
If the scar tissue has helped blindness, arnica will not help. Then a remedy like Cineraria maritima will help. So
How do
you
you
want to
spell
take
that?
a remedy that'll dissolve the scar tissue.
I need
So
So-
arnica will never work on scar tissues.
Arnica is to create tissue, not to
Yeah,
remove
because it
tissue.
will cause more scarring then.
Yes. On the
Ah.
other hand, if there was a wound that did not heal properly because of the bruising and contusions, then arnica will help. So you have to
Okay.
look at your wound, you have to look at where you are and apply arnica. It's great in plastic surgery. Why? Because the wounds are superficial. Mainly the plastic surgeon is ripping off the skin and pulling it back up to take away your wrinkles. So it's very, very close to the surface of the skin. So arnica heals it beautifully. But if it was a deeper incision into your abdomen where you've gone through 7 layers of skin, dermis, fat, omentum, muscle, then you need something like a Staph aureus or something like a ledum to start the healing process.
So when there's a deeper cut, if we give arnica, then it just closes it very superficially. And
Arnica
there is no
yeah.
healing taking place inside. And that's why it's difficult for that thing to heal, right? That's why it becomes a botched surgery or something like that.
Exactly. Especially if you want that wound open. Like for chemotherapy, people put in PICC lines. You don't want that hole to close. Or if you have implants in your body and you take silica, the implants are going to want to come out of your body. And so if you have a stent, be careful taking silica because it'll try and dislodge the implant and pop it out because your body doesn't know it's a stent. The body thinks there's a thorn in your heart, and it's trying to get it out.
This is maybe a bit of far afield, but it's in my particular case. So I have cataract in my right eye and had cataract surgery in the other eye. In the place where the cataract exists, is there a homeopathic remedy or approach that would remove the cataract?
Yes. So cataracts are from glycation, from sugaring up of the lens or scar tissue. So things like Cineraria maritima will be very helpful because it'll clear the lens, it'll clear the aqueous humor. Things like thiocyanamine will be very helpful in removing scar tissue, although earlier is better. But those are the remedies that'll help to absorb scar tissue. Those are the remedies you want to use.
So that would be post-surgical, is that correct?
Yes. On the other hand,
And so if there was, looking for an alternative, not pre-surgical, but an alternative. And I've read quite a bit about removal of cataracts with all sorts of things that I've attempted. So I'm wondering if there is something homeopathically which will actually dissolve or remove the cataract itself.
Oh, like a inserted cataract, a lens. I mean,
Yeah,
are you talking about the cataract, or are you talking about the new lens or old lens?
with no lens implantation at all. But
Okay, the old cataract. The old
Yeah.
cataract is blurry because the lens is damaged. And
Yeah.
typically it's a sugar issue, it's a blood sugar issue. And so Cineraria maritima is excellent for that.
would you spell those or at least post that?
Yes, it is on this slide at the bottom right.
Just
Cineraria.
found it.
Cineraria, maritima in low potency, maritima, either 3x or a Q tincture, 5 drops 3 times a day until your eye is a lot clearer, lens is a lot clearer.
Got it. Thank you.
So Cineraria maritima, we can use it even during a surgery of cataract, after the surgery, or
After
even
surgery.
even
After
without the
surgery,
surgery.
if you
If
have
someone
problems.
yeah, if someone doesn't want to go for surgery also, it is the same thing because that will dissolve the scar.
Yes, yes, absolutely. It's a
Okay.
great eye remedy. Alrighty, and if you're diabetic, if you have high blood sugar, where does it hit you? In your capillaries. Capillaries are what give blood to your eyes. They perfuse your eye with blood, and so anything that causes neuropathy in your eye vessels or neuropathy as a result of high sugar, you want to change your diet. So go back to that diet early on. A lot of fats, a more high fat, higher meat, because what is a wound but meat? And you give it the meat that it needs to heal itself, and it'll heal very well. I have seen people on high meat diets barely have any problems after surgeries. They heal very fast. On the other hand, if you don't have the amino acids to heal, you're going to have a problem. So food is very important. Alrighty, this is a dilatation and curettage. So anytime people have miscarriages or things, placentas get stuck in the uterus, or you're just getting a curettage because of white discharges from your uterus, and you scrape out the uterus, frequently there are adhesions. And if you, after surgery, take arnica, it's going to granulate those things. It is going to heal it before it has dripped out of your body. All the stuff has drained out of your body. So you don't want to take arnica after adhesion surgery. You want to take pulsatilla. Why? Because it opens up your uterus and drains the tissue fluids. Later on, you might want to take arnica to heal the whole thing. But to prevent adhesions, you have to take remedies that cause adhesions to disappear. Thiocyanamine is a great remedy to prevent adhesions and to get rid of adhesions. Because when adhesions happen in your uterus, you get these interconnected fibroids stuck between your fallopian tubes and your uterine wall, and you get severe cramping and pain. They might adhere to your abdominal walls and so on. And people have to do surgery for those adhesions. Why not take homeopathic remedies which will prevent that problem?
I have a question again about post-surgical operations that occurred many, many years ago, like my tonsils removed, adenoids, all that kind of stuff. And I'm wondering or thinking, is there something in my conditions right now which are related to those things which happened maybe, I don't know, 60, 70 years ago?
Absolutely, absolutely. The primary lymphatic organs, not nodes, have been taken out. So infections are traveling deeper into your body to get to the lymphatic system, which will deal with the infections. So it is a great curse that we took out adenoids and tonsils in very young kids because they are the first line of defense. So that's one thing. And then to deal with the infections, homeopathics really will help a lot. And in fact, they're a miracle for people without tonsils or adenoids. Because most of these people, you get an infection, it goes straight to your chest, goes straight to your throat. it bypasses your early immune response.
I have a question.
Mhm.
That's regarding this pulsatilla. Now that opens the os and it drains tissue. So my question is, I think pulsatilla opens even the sinuses,
Yes.
the nasal sinuses, which helps in draining.
Yeah.
And that's what even here it's the same thing.
It's a drainage remedy. It's a great
Yeah.
drainage remedy. Yeah.
So my
Like-
question is, if someone has prolapse uterus now, so again the not that the os is open, but it's a different issue because there is prolapse could be because of the not I'm saying the tissue's been lax, but it is because of the improper fascia over there. So if someone takes pulsatilla for some other remedy, and then if it is contraindicated somewhere else, does it work on the on all organs equally, or it just works on the sinuses when it is taken for sinuses?
That's a
Do you
very
get-
good question.
Okay.
A lot of the homeopathic remedies, most of them actually work on the whole body, but there are remedies that have very specific actions on your organs. And pulsatilla has it on your varicose veins, that heavy, watery feeling where you feel bloggy. Your uterus is filled with too much water, and pulsatilla helps it drain. If it's very venous and very congested, it becomes heavy and then it's dropping down. So the key is not to put in pessaries or put in mechanical implements to hold it up, but rather to change if you're hemorrhoidal, you tend to have more prolapses. That's because you have a venous constitution. Pulsatilla will help, hamamelis will help. These are remedies that help your circulation and help you to mop up that water in that organ and drain it.
So it's nowhere that it pushes the uterus down. It's not like that. It, as you say, it works more on the venous circulation. So it helps in moving the fluid back to the system, the circular system, rather than staying down, right?
Exactly. So what people do is, oh, your uterus is prolapsed, so that must be the fault of the uterus, and let's just chop off the uterus. No, what you do is address the condition of the body. The uterus, which is probably 3 times its normal size, will shrink, and when it shrinks, it bobs right back into place like a buoy in the waters, and all is well.
Okay. Yeah. Thank you.
Okay. So remember, think about things. It's very important in surgery to ask yourself your feelings or your body's feelings regarding the surgery. There are many women who have breast cancer and they don't want to remove their breasts. This is not elective surgery for them. They're very angry. There are people who've been traumatized and get cancer. And so they may be suffering from rage. They may be suffering from sadness or woundedness or hurt, in which case the right remedies are the emotional remedies. Say for Lilium tigrinum, you're going in for these kinds of surgeries. It's more reproductive organs, Lilium tig, and you're enraged at your lot in life, or Nux vomica. So great remedies to give people in preparation for the surgery. That does not mean you give them the day before, but rather prepare them emotionally for that experience. If a person gets very nervous, especially around dental surgeries, I've noticed there are people who freak out. These are people who just dread it. They are like, I don't want to see a dentist. I'm dying and I'll never come out of this. And dread, they like feel they're going to die. Aconite is their remedy. And there are people who are just very, very nervous. For them, gelsemium is the right remedy. So take a look at that person or yourself and see how you feel. But don't take random things in anticipation of surgery. That's not a good idea. If you take Nux and Arnica before surgery, you're going to need much more anesthesia to knock you out. But do it, yeah.
I've got a question, as long as you have emotions on here. It brought up some memories. When I was quite young, I used to wet the bed. And my parents figured the solution to that was to bring in this man who demonstrated that he had a pad that as soon as any urine touched the pad, a bell would go off and it would wake you up. So it freaked me out thinking of sleeping on this thing and a bell going off.
Oh God.
I never wet the bed again after that. So, I mean, okay, now that's the first part. The second one is that I kept having tonsillitis. And they told me if I get it one more time, I'm going to need surgery. And I never got it again.
Wow.
So when you talk about emotions, I'm looking at how did I was so young then. What did I do to activate my body to heal itself? How did what did my body know that I didn't know at that age so that it could heal itself and I didn't have to have any of those procedures?
Well, you're very much in touch with yourself, Sunshine. You've always been. You're very intelligent. You've always been in touch with yourself. And this was almost like an emergency life-saving technique for you. You were being attacked on all sides. And this is a child's response to protecting themselves. And you did a wonderful job. Although there could have been better remedies to help you deal with the urination or the tonsils, which would have taken away those problems rather than terrified you into submission.
Exactly. I mean, they never treated me after that for it, but it went away. Yeah. I thought it went away,
Yeah, that's deep trauma, man. That's deep trauma to threaten a child like that. Wow. Thank you for that. So ask yourself, there are women who have had trauma, then they develop brain cancer, and now they got to get this cancer out of their brain. What sort of feelings are you having? And you need to be prepared for your surgery with that addressed. There are some people who are just very passive, like whatever, I don't care, maybe opium is their remedy. So address that well before the surgery so that you're well prepared for the experience itself. Now, you've gone in, unfortunately, you needed it, you tried everything homeopathic, didn't work, and now you need to get this, gallbladder removed or a rectal tumor removed because it's now 5 inches big and you can't digest anything. You're gonna have a question? Any question? Okay, no questions. Anesthesia, wonderful remedies are phosphorus and nux moschata. If you're having troubles, you're feeling woozy, nauseous, you're having troubles getting out of anesthesia, this is where a lot of NBWS has never been well since I got knocked out by that anesthesia. Guys, if you're taking phosphorus, nux moschata, or the right remedy, or even the anesthesia remedy, there are homeopathic remedies that are made from the same substance, they would have really helped. They would have really, really helped you. Bleeding, phosphorus is a great remedy. Melilotus is a great remedy. Tamarind is a great remedy for bleeding, but phosphorus, most people have phosphorus, use phosphorus by all means. Now you get surgery in your abdomen, you get it in your arms. It can be muscular, it can be musculoskeletal, it could be just skeletal. So based upon that, your pain remedies have to reflect those tissues. So don't just give one thing for everything. For your soft tissue, abdominal surgeries, which are knife-like wounds, Saphysagria is a wonderful remedy. Wonderful remedy. Soft tissue contusions, like the one you see in that picture. Arnica is very good, where after surgery the wound's healed, but it looks like that, black and blue. But if someone hit you, like you got gored by a cow, for me, what worked was sulfuric acid, conium, and Staphysagria for the internal. There was a wound on the inside of my abdomen that I could feel was sort of cut and bleeding, and immediately I would have immediate results with that. And my contusion or my adhesion has now gone away because the umbilicus is a very big meridian, electrical meridian and node, and so you want that surface or that area to be adhesion free. For bones and periosteum, symphytum is a wonderful remedy. So if you're getting a fat fracture fixed, if you're having bone surgery or kneecap surgery, Kali iode is great. I should add that to symphytum. If you have swellings in your kneecaps or toes or heels, Kali iodatum is good. Symphytum is good for periosteum, for fractures that are not non-healing fractures. Silica is excellent for non-healing fat fractures. And I'm going to write that down because it's so very important. How do I do this here? Silica, what was the third thing I said? Symphytum, silica, Kali iode.
Yes.
Iodatum. Okay, so those are very important remedies. If you have laparoscopic surgery, and a lot of surgeries today are laparoscopic, don't forget to take ledum palustri, puncture wounds. Staphylococcus aureus if the wound is more like a knife. Ledum if the wound is more like a puncture wound. Frequently, they will blow you up for laparoscopic surgery with a gas, and afterwards the pains are excruciating. So keep carbovegetables handy, or Raphanus sativus.
Question, what is laparoscopic surgery? I don't know what that is.
Laparoscopic surgery means they will put a camera in one tube and a knife in the other tube, and they will not open up your stomach, but they will use these two tubes to sort of guide them to the right spot to either remove your gallbladder or take out a tumor or what have you without opening up your whole body. So these are good and bad in that you can't really examine the abdomen, but at the same time, there's not as much damage done.
I have another.
The gas, you said carbo-veg and?
Raphanus, Raphanus, and it comes up later.
You mentioned, Sushma, that when you were gored or injured by the cow, that I remember you telling the story of you changed the homeopathic remedies you were using at different stages of your recovery.
Yes.
Is that the same kind of thing of talking about, what do you do immediately? What do you do in the first 2 days? Or then what do you do 6 months and all that stuff?
Exactly the same thing. Exactly the same thing. You look at your symptoms, you see what's going on, you look it up in your Boricae Materia Medica or some repertory online, and you will have your set of remedies. Or you look at this PowerPoint and you will know what to do. Okay. Musculoskeletal, this is your fascia, your muscles, your bones, your periosteum. Rest tox is excellent. You're sprained and strained and you need surgery in your connective tissue and tendons and wrist surgeries. Rest tox, symphytum, and bryonia will help with the pain, guys. 1M, 10M. For pain, don't hesitate to use high potencies. 1M, 10M, 50M. Keep them on hand. If you have tendons or connective tissue repairs and surgeries for sprained ankles or torn rotator cuffs and all that, Rust, Ruta, and Arnica are fantastic. Keep those on hand. So it involves keeping a few remedies, but you've got like a couple $100 worth of, just get one of those kits and you'll have it on hand and you can take it to hospital. You will have have it in bottles of water, by the way. Don't sit there popping pills or your surgeon will object to this. Make it look like a water bottle or holy waters that you're drinking out of for your spirit or for hydration. Don't create extra drama and extra stress and trauma for yourself.
I have a question about arnica. So arnica, we can use it in connective tissue and tendons. So this is how many days after surgery? Because you said arnica will be causing scarring and we don't want scarring initially. So is there any time frame for that?
Yes, as soon as the surgery happens, give it, so in other words, if you have a fracture, don't give symphytum until the doctor has set your fracture or the bone will set in that position, right? So once you've got the surgery, let's say you had a bone fracture that the surgeon, he popped open your skin and your tendons and cartilage, he fixed the bone, so now you can give symphytum. He fixed the tendons, Now you can give Ruta and Rus, and he fixed the skin. And now you can give arnica for the contusions. But in the early going, you're giving Rus, Ruta, and Staphylococcus aureus. And then when it's sort of in a couple of days, when it starts to heal and it's black and blue, that's when you start to give arnica for it to
Okay.
heal on the outside.
Okay.
Arnica is more superficial.
Hmm.
Deep tissue, you got to use other stuff. Hypericum, if there's nerve damage, use hypericum. If you have stinging pains or pains that are radiating, that's hypericum, folks, after surgery. And people who have used that have rapidly gained their nerve function back. And people who have not used that frequently have attacks of sciatica at that surgical site, or they'll have terrible neuralgic pains, all avoidable, all avoidable. So when you break something in surgery, your bones have to heal, your periosteum has to, look at it from the inside out. Your periosteum has to heal, your tendons and connective tissue, your fascia have to heal, your organs have to heal, your skin has to heal from the inside out. Let it do it, and it has to drain and suppurate first. If it's something that needs to be open, you want to use the appropriate remedies to keep it open.
I have a general question about post-surgery. As I mentioned earlier with my mouth and teeth extractions, the healing took place relatively quickly. Is there, and it's a little even hard for me to maybe process the question, but does it depend on individual constitutions about how quickly surgical repair or surgical improvement occurs after surgery?
Absolutely. If you're on a good, high vitamin, animal vitamin diet, you will heal in no time at all. If you're on a very, very low nutrient density diet, it's going to take you forever. And so I don't think of homeopathy as the be all and end all of life and medicine, although I love it. Food is your first medicine. Food, how you've exercised the muscles around that surgical site, etc. It's very important in healing.
Thanks.
All right, pain management. That's the most important thing. Avoid morphia, avoid fentanyl, OxyContin, pain Advils, and Tylenols. What do? They break your connective tissue. They reduce your respiration. They put you closer to death. There are fantastic homeopathic remedies for pain management. Take them in high potency, whether it's arnica, hypericum, chamomilla, what have you, Staphylococcus aureus. Take them in high potency and your pain will be managed. That having been said, for some people, the pain is unmanageable, and by all means take other remedies. But understand that homeopathic remedies have no side effects. You're not going to be sedated. You're not going to feel woozy. You're not going to be addicted to that pain drug. You will just heal faster because your vital force has taken over. So you're going to have pain. You might feel spacey, woozy, nausea. Phosphorus is great. If you feel like comatose and not waking out of your anesthesia, opium is great. Cannabis indica is great. Phosphorus is great. Nux moscata is great. And I should write those things down. Why did I not write them? If the symptoms agree. What was the fourth remedy I said? Opium, phosphorus, Nux moscata, cannabis, indica. And the potency again depends on your sensitivity. You could be very sensitive, and I'm very sensitive. For me, a 30x is fine. For arnica, takes my pain right away. Remember I told you about when the wheelbarrow filled with sod, dirt fell on my calf? My entire calf was in excruciating pain. It was black and blue. I literally crawled to the kitchen, took an arnica 30C. It was like a buzz. It was like my seeing God moment of homeopathy. One moment I was writhing in pain. The next moment I said, okay, I'll take the dogs out for a walk now. And I did 2 miles, and it got better very fast.
Mm.
So depends on your sensitivity. Know yourself. Any questions?
If you were taken, maybe it's intuitive, you said 30C would be fine for me. But if you'd taken 1M, for instance, instead, how would you have known the difference?
Oh, a very good point. I broke my toe coming out of the bathtub, and I took Arnica 1M every 5 minutes. The pain was so bad, and that made it okay. That made it okay. I put it, bandaged it together with a little popsicle stick to my other toe, took Arnica 1M for several, for about an hour every 5-10 minutes, and no pain. Healed
Ah.
beautifully. But for this, it wasn't even a 30C land, it was a 30X. It was like a cell salt arnica.
Right. But again, that's part of my question, because I've done a little bit of reading about the difference between C and X having to do with the different protocols for preparing them.
Mhm.
And I know sometimes in working with you, you've had something with an X or sometimes with a C. So is that intuitive or knowledge that you provide, or where does that come from?
Both. Intuitive knowledge. Sometimes I want you to take a remedy for longer periods of time and more repeated. I would generally give lower potencies, but that's not to say that's always the case. I mean, I took Arnica 1M every 5 minutes. It
Yeah.
all depends on your sensitivity, how bad the pain is, how severe the condition is, and what you have on hand. At the worst case, whatever you got is your remedy.
Got it.
Everyone does not have 15 potencies of a remedy. So whatever you got, take it. If you feel better, great, once it starts. And take the pain pills before the pain starts, for goodness sakes. Many people try to be stoic. Don't wait until you're crying in pain, especially after certain surgery.
So if
Take
I
them.
moment expand on the question, because I think it maybe wasn't clear enough, the difference between X and C for the remedy, as I've read it's a bit about the different types of preparation or the different origins. Is there something, again, intuitively, or suggest that this should be an X form or a C form, or with some other source of information?
Not intuitively per se, but for the level of the problem. For greater pain, a greater potency will help. So I would do for surgery higher potencies. Keep Arnica 1M, 10M, 50M, or Chamomilla, whatever it is, Hypericum if you're doing neurological surgery, on hand, so that you don't have to resort to morphine or OxyContin and so on. Because a lot of the time, they don't really help with the pain. They make you unconscious. So the pain doesn't go away. You're just not there. And so these are actually remedies that address pain.
Let me ask
Your question is,
again.
how do you know? How do you know?
How do you know the difference between 30X and 30C that should be used on a particular situation?
My bias is to use the lowest potency you can that works. And if it doesn't work, then go with the higher one. So for my wheelbarrow accident, the 30X worked great. So I continued to take it. For my broken toe, the X and the small C's didn't work. So I took the 1M.
Oh, okay. So it's tuning into what seems more appropriate for your condition.
Right.
Okay.
And
I have
all
a
of
question.
yeah.
Uh, now suppose if someone doesn't have 1M or 10M and has 30C, then does making a water dose of that 30C and drinking all of that glass helps in reducing the pain?
Yeah, just take the 30C very frequently. And the way to take the water dose is to go bang it. And so every time you bang it, the potency changes slightly. Take a sip, keep doing it until your pain goes away.
And suppose if it is not working with only sips, can someone just gulp the entire glass so that the entire dose goes and starts working fast, something like that?
Sure, you can, but more is not necessarily better. That having been said, my sister-in-law relates a story where she was giving Thuya, I think 200 or 1M or something, to her daughter for a wart that she had. And this daughter, loving a sugar lover, was very young. She took that whole bottle of the Thuya, and within 2 days, her big wart just dropped off.
Ah,
Yes.
Because I was, now that you said about Thuya, I was reading about it. It's basically, can we use it for a skin tag also? I know skin tag is
Absolutely.
generally for more of sugar, and I've got one which just irritates me. It's on my leg and it rubs on my clothing. And then I was reading about Thuya occidentalis, right?
Yes.
Yeah, and so okay, so that can be used in that fashion also. Okay.
Yes,
Wow.
absolutely. Absolutely. You can take Thuya, depending on the symptoms, causticum or dulcamara. These are the three wart and tag remedies that are excellent. Thuya,
Causticum and Dulcamara.
causticum, dulcamara. Read the
Because
recipe.
I just took because I remember you had given Thuya for Amok. I have 7 and 30. I took one, and then the another day, like just 130 C at night, and the next day I felt a little less pain. But then I didn't continue because I was confused, whether that would really help, because it was clearly written for warts. It was not for skin tag, which article I read. And then I thought maybe wart is also equivalent to skin tag. Maybe it would help. So I just popped that.
Yes. Yeah, that was
Okay.
good. Good thinking. Good thinking. If it helped, if the pain went away, then that's the right remedy.
Okay, I have one more question. Suppose if someone is prescribed antibiotics, and now because the antibiotics are not good and then they damage the gut flora. So what is the homeopathic like relevant for antibiotic?
Very good. Polyantibiotics. Excellent question. If you have to take antibiotics, please take polyantibiotics, homeopathic remedy. You can take it in 200C, 1M, 10M. You can buy it from Helios, Homeopathy Plus, and all that. But get the effect of the antibiotics out of your system. Let them be just for killing the infection and not destroying your gut. People with antibiotic use during surgery have severe gut problems, which means psychotic. Gut is brain. Remember, gut is brain. They have depression, suicidal tendencies, and so on after surgery. Polyantibiotics, take homeopathics for the effect of antibiotics during surgery. Good question and good point. I should have thought of that.
But one shouldn't say no to the antibiotics then if someone is undergoing surgery.
They will
Like,
require them. Many times they will require them. You can say no, you can say don't, but you are bearing the risk. And many people don't want to take the risk. And they're going and they have to sign a waiver saying doctors can do whatever they please, and and you can actually say no antibiotics, but then you're taking the risk of the surgery. They typically put antibiotics in your IV, so it goes through the IV. And so you want to take polyantibiotics, or you can take that particular antibiotics, take a drop of it, whatever you're getting, make a homeopathic remedy of it and take it. That'll make a huge difference in the side effects.
so polyantibiotics, homeopathics is one remedy? Is it a name?
Yeah, it
Like
is a
Arnica?
combination of many remedies, like different types of many antibiotics. Excuse me. It is a combination of many antibiotics made in homeopathic form. Ideal is you take the remedy that is the antithesis of the antibiotic that you got. So if you got penicillin, you take penicillinum, right? The penicillinum, the drug, homeopathic remedy. And you can easily do it. You can do it yourself, and it'll really, really help ameliorate the diarrhea, the bad effects, and ferments, of course.
How do you do it with penicillin then? Or
You
any
take a little
antibiotic?
tiny amount of the penicillin and some vodka or Everclear, some alcohol, dissolve it, take a drop of it, put 100 drops of water in it, take a drop of that, put 100 drops, and shake it, or put tap water, turn on the tap water, throw it out, put in tap water, that's a 6C, and you take it. And it seems, a lot of people think, what, this is voodoo, it doesn't work, but try it and see what happens.
So you mean
Minuscule.
suppose if someone is being prescribed cefizime for a dental surgery, so you make a dose of that cefizime, right? That's
Yes.
what, yeah.
Yes.
And so should I go? I'm just saying this. Should I go and get the syrup of cefizime, or should I break the tablet or open the capsule and put some content, vodka and then water?
Exactly whatever he is getting or that person is getting, you take that drug, take a drop of it, put it in water if it's water soluble or alcohol soluble. If you want to keep it longer, do it in alcohol. And then keep a tincture on hand. And then every time you need it, you take a drop of it, you put like 1 drop for 100 drops of water, you shake it, and you give that person 2-3 times a day, and it will really help.
So the person takes the antibiotic and takes this also.
Yes, yes. Or
Right?
after the antibiotic also.
Hmm.
Sometimes you don't remember to do it. So after the antibiotic, you're having all these symptoms. You know, you've got diarrhea, you don't feel well, you're losing weight, you feel depressed, you feel irate. Many children have PANS and PANDAS. So there's a kids with autism are on so many antibiotics for their sore throats and whatnot because they get infections. Then they're on antibiotics, then that causes that strep thing to go to their brains, and they have PANDAS, which is autoimmune neuropsychiatric disease caused by streptococcus, for which they give streptomycin. And it's the theory is too many antibiotics have contributed to the PANDAS. Instead, if they took homeopathics, they would never get the PANDAS. And these remedies of the antibiotics are fantastic to treat PANS and PANDAS.
Hmm.
I have some questions. I have a
Okay.
couple. Is it true that the Bach flower essences are homeopathic?
Yes, they are.
Okay. That you're answering that, and what you just gave is for the formula for creating the homeopathic remedy is what was starting to answer my questions. I thought, what if I'm at home and I injure myself and there's no way I can get to my homeopathics? Can I go into my garden and grab an herb, or into my kitchen and grab some of my herbs from my kitchen and do that recipe that you gave to create a homeopathic? I mean, can I make an instantaneous first aid for something that happened if I don't have, and if I can, either muscle test or intuitively figure out which one it should be, can I do that?
Absolutely, absolutely. And you know what they say, the remedies for everything that ail you are within 150-mile radius of your home. So the herbs, the weeds, the thistles and the dandelions and the thyme and the calendula and the daisies are fantastic in tincture form. You just take it, stick it into a little bottle of alcohol, take a drop, succuss it with some water, and take it.
Okay.
Nettles are wonderful urticarians for spleen issues and liver issues. To make a homeopathic dose of the nettle tea, and it's fantastic. And it has a very different effect from taking that herb in real time, meaning non-homeopathically. It has the opposite effect almost.
And the Bach flower essences are mainly the emotional ones, right? They're more for emotions rather than
for trauma and so on. And they're wonderful for emergencies, sudden trauma, accidents.
And also, I mean, I used to give them, not give them, I used to tell them in my childbirth classes, you can take the one overprotective mother, because when you're smothering your child, overprotecting them, if you take overprotective mother, you become much freer and much more trusting that the universe is going to help you take care of the child. You don't have to smother the child.
Exactly. Such a good point. And now we need to address Renee's issue, wound. Renee, are you there?
I'm here.
Okay. So the wound, if it is deep and is not healing, Staphylococcus aureus 201M is your primary remedy. Once it has started to heal, then you can use arnica for the bruising and contusions if they're purple. You can use calendula for granulation. So start with Staphylococcus aureus, go to calendula. So you're going from the inside and out. What I wanted to explain was the sort of the logic behind it, so that going forward, you can always think about it and do it yourself. So if
Okay.
it is a laceration, which is you fall down and your skin is torn off, that's a calendula injury. If it is a deep cut, then it's a staphysagria type injury. And you take staphysagria, once it starts to heal from the inside and out, then you can take calendula and arnica. You also want to take thiocyanamin to prevent adhesions if there are adhesions. If there are no adhesions, don't worry about it.
It's not a deep cut. It's more the skin has completely come off, and it's a large, like an L shape where the skin has come off.
Oh, calendula, totally calendula.
Calendula.
Yeah, calendula internally, calendula on the wound itself for it to granulate faster. And to prevent sepsis, take arsenicum and Hepar in your case. Arsenicum 200,
Arsenicum.
Hepar sulf 200. 4 times a day.
Calendula, arsenicum, and arsenicum, what?
200. Arsenicum 200, Hepar 200 in alternation every couple of hours or every 4, depending on how serious it is, to prevent infection.
Okay. And it's just because it didn't heal the two skins together. It's too wide. That's where she says you're going to have a scar.
Oh, did she say you're going to have a scar?
I will have a scar. It's on the back of the leg of
Okay.
the
If there's going to be a first calendula, is your first port of call, and for the scarring, you're going to do thiocyanamin, low potency, 3x or 6x. Thiocyanamin.
THI.
So I'm just going to write
Okay.
these down. So you're
Got it.
starting with calendula.
Right, that one I got.
You got calendula, Hepar and ars, that's for infection. And I'm going to say Renee here so I don't forget. Calendula for the laceration, Hepar arsenicum for the infection, and thiocyanamin for the scar tissue.
Beautiful. Thank you, thank you, thank you.
And guys, this is not for everybody. For all of you, you're not going to get infection. In Renee's case, there's a risk of infection, and if it has delayed healing, there's probably neuropathy. That is why we're doing the Hepar and arsenicum. And that's going to address the purple. It's going to turn purple and red and necrosis and all that. This will address all of that. And the calendula needs to be in a higher potency. So tincture on the wound and 200 potency for internal. Hepar arsenicum is 200. And thiocyanamin is 3x or 6x.
Hold on.
All right. Anyone have questions on that? If something is not healing, if you have diabetes, go ahead.
So thiocyanamin, because now the skin has not healed in Renee's case, right?
Mm-hmm.
So it might turn into a scar. That's why you're giving as a prophylactic over here.
No, it's actually adhesions are being created because the skin is not granulating. So what will granulate the skin is the calendula. It'll cause the skin to move over and grow. So she's gonna take the tincture of calendula, which you'll find on the internet, and apply the tincture on the wound, and also take in calendula 200.
Straight means that tincture would be straight, that drop. She won't dilute it, right?
Yes.
Okay. And what happens when the skin has healed, but you can feel the scar down? Then does the treatment stays the same, or you just take thiocinamide?
Thiocyanamin is in the early days to get rid of scarring and prevent scarring, but not after 6 years. After 6 years, it's a bit difficult, but you could still have luck. Try it. But in the early going, typically.
Otherwise, it's Staphysagra only.
Otherwise, it's staphysagria for the effects of that wound that were not healed. Hepar arsenicum for the infection. And if you get sepsis, we're going to get to that. So wait, Renee, for 2 more slides and we'll get to the sepsis. So if your body gets infected from that wound, what to do?
Okay, I have a question.
Mm-hmm.
Because at times when I've injured myself, I've scraped something and it's bleeding and, skin has come off or there's a flap or something. People say, wash it off right away so that you don't get sick. Well, I was taught early on, never use soap and water on it because that prevents it from adhering and healing properly.
Yes,
So-
never soap. But if you have dirt in that wound, you do want to clean it out, and with water or alcohol or whatever you have on hand, it's a good idea to, otherwise it'll heal with the dirt underneath the skin.
Right. Never, people say, use soap to clean it out. Yeah, no.
No soaps, nothing. Just plain water. If you see debris, just clean it out with a whoosh of water, with a spray or something of water, and then it might hurt a little bit, but then you apply calendula tincture on top and let it heal.
Good, thank you.
Brief question. You used the term granulation a couple of times. I think I have an understanding what it means, but if you would explain it more specifically, I'd appreciate it.
Yes, granulation means skin formation. Simply put, skin formation. And you
Right.
want skin to form when the bottom is healed, when it's done pussing out, when everything on the inside is done doing. If there is wounds that need to suppurate, please do not let it granulate. And that's where, Renee, you have to see if it is still, the wound is still suppurating, or if there's pus, take the arsenicum hepar first, and then internally take calendula, maybe not apply calendula on top. So use your best judgment to look at it, or send me a picture. Text me a picture.
I'll send a picture.
Yeah, okay.
Thank you.
All righty. Who had a question? Land.
I just asked about granulation.
Oh, okay, yes. So granulation means the formation of, it's
Yeah,
just a
right.
fancy word to say skin formation.
You
Sorry.
answered. Yes, thank you.
Okay, so post-surgery, post things like plastic surgery. I'm giving you a picture of a very botched plastic surgery. Look at how beautiful this woman was and what happened after plastic surgery. Never avoid plastic surgery, guys, unless you've been in a fire and completely deformed, because a lot can go wrong. However, for plastic surgeons, arnica is the miracle drug. It heals their wounds 70% faster if you get arnica. Valerie, you have a question.
Yeah, so I see on down here, and I know you're going to get to it about the C-section, which I had 30 some years ago, right?
Mhm.
But that scarring has never gone away, and that's very hard tissue there. And I'm wondering if this Bellis is going to help that at this point or no.
Absolutely. Bellis is for all trauma, old injuries, all Gardner's injuries, all C-sections, for Vidya, you too, for the perineum. Bellis is fantastic. Why did I not think of that? And also castor packs to soften the adhesions, Bellis perennis to heal it, gentle massage to get rid of the adhesions and scar tissue.
Thank you.
All right, so plastic surgery, arnica is like the miracle medicine for plastic surgeons. Literally, it heals 70% faster because it's all shallow wounds that they have created. They're just simply pulling up the skin over your face. Injury mix. It's okay if the injury is from the outside in to do polypharmacy, which means multiple homeopathic remedies in one pot of water. Don't let anyone dissuade you, because it's way better than the alternative, which is pain meds and Vicodin and all these other things. So the injury mix, depending on the circumstances, folks, can be any combination of arnica, bellis, calendula, staph aureus, hypericum. You decide what's going on. If you're getting a valve put in your eye, don't use arnica. Use bellis, or even not even bellis. I would say use something that'll keep it open. In fact, don't use any of these things. You want it to be open. Use pulsatilla or something like that. But if it's a general injury, arnica, bellis, calendula, staph aureus, hypericum is fantastic. Your kid falls down and there's contusion. So different parts of the body, different remedies. If the person hits their head, if you feel you're contused and you're speaking funny, nat sulf for brain injuries. For spinal injuries, hypericum. So know the difference. Nat salt will not work for spinal injuries. It'll work for brain injuries or head injuries. Hypericum for spine. Are you following me in the use of different remedies for different tissue types?
I'm following you, and it's the same challenge that I have is the information as you give it seems very clear. But then other than reviewing your talk several times, I don't know that I can retain most of it.
If you watch this a couple of times, it will get embedded in your head, believe me.
Great.
And all you need to do is go to this picture which says post-surgery, pre-surgery, and so on. And generally speaking, prepare for it. Keep a kit, keep some bottles, write down a plan of action, and consult with me or a buddy or a homeopath, anybody, and to say, hey, I'm getting this surgery. Did I forget something? And I will remind you, hey, you need hypericum, or oh, your bone's being replaced, or you're getting a hip replacement. You need symphytum, ruta, your periosteal remedies.
Got it.
Soft tissue is arnica, and for longer term damage, it's Bellis perennis, which is fantastic for soft tissue damage, such as C-sections gone bad. Eye surgery, aconite and symphytum are wonderful. Symphytum for more the bone around the eye, the orbit, and aconite for any surgery of the eye will reduce trauma, reduce blood clotting, extravasation, eye injuries. Aconitum is like the arnica for the eye. So keep that on hand land at all times.
Okay, got it.
Ligaments, if you have ligament and bursa injuries, which is, more fascial, then symphytum, ruta, calphos is a great tonic, 6X, take it repeatedly. So when you mangle your wrist and it's healing, calphos is a great tonic remedy. The bioplasma, the cell salts are great to take to heal better.
So that is Calcarea phos, CL.
Yeah, Calcarea phosphorica. Ruta graveolens and symphytum officinalis. Post-surgery, periosteal tendon ligament injuries, ruta. If you have a laparoscopy and have gas bumped into you, carboveg, raphanus sativus, wonderful. Sometimes for C-sections also, they pump you up with gas to get the baby out, and you get horrible pains. Don't take pain pills, take carboveg and raphanus. Deep tissue bruising that arnica does not touch. This is trauma deep inside your skin. Sulfuric acid, graphites, Bellis perennis, depending on the symptoms. Sulfuric worked for me. Conium will work great for deep tissue injuries also, as does Bellis. When your fractures are not uniting, they're refusing to fuse, silica. For your actual fractures, after they've been set, for bone pain, symphytum, eupatorium, bryonia, silica, and you can use these as a combined remedy because it's from the inside out. Sprains, if you have a lot of sprains, keep ruta, kali iode, symphytum, rus, bryonia on hand. If you get repeated sprains, strengthen your body with strontium carbonicum or nat carb or cal carb. Take repeated regular doses until your elbow or your knee or your toe or your heel becomes stronger, or your ankle becomes stronger. If you have head trauma, nat sulf. Spine trauma, hypericum. If you have plantar fasciitis surgery, Rus tox is excellent, excellent. If you have neuromas, which is, these little nodules you get on your nerves, on your hands, tarsals, etc. Calflor and rhododendron. I misspelled the rhododendron, I'm sorry. Rhododendron.
Can I ask you another question?
Mm-hmm.
The last slide you had, I didn't finish writing down some of the notes. If I could just for a second.
Sure.
Yeah, thank you.
I will even repeat it. For the periosteum, tendons, and ligaments, you do ruta, laparoscopic gas, carboveg, raphanus, deep tissue, sulfuric acid, graphites, and bellies. If your fractures are not united, and this happens a lot in the elderly, they have fractures of the hip, especially if they're taking that fluoride drug to reduce fractures. It actually causes fractures, and the fractures don't unite. Take silica, and instead of taking these dreadful drugs which cause a lot of side effects and actual fractures, please take Symphytum, Eupatorium, Bryonia, Silica, Ruta, longer term if needed. And raw milk, a lot of raw milk. We did a DEXA scan on a client of mine once who had osteoporosis, 38% improvement on raw milk in under 6 months. For an 80 something year old, that's fantastic.
And I love the common name for the symphytum, which is bone knit.
Yes, yes.
No, it tells you right away what it's used
What
for.
it is. So true. You, I think, gave me my first plant of Symphytum, my friend. Thank you.
You're welcome.
I have Symphytum everywhere now. It grows well. The deer don't like it. All right, where were we? Post-surgery, head trauma, spine trauma, we covered that. Infections. If you have infections that are smelly on your skin, Renee, you want to get gunpowder. Oh, I totally forgot for you. Gunpowder is fantastic for
Gunpowder.
healing wounds. And get a low potency, like 3x, CX, 6x if you can find it, but get a higher potency too, 30C, 200C, 1M. It's magical and miraculous, and you need it, my friend.
Gunpowder.
Gunpowder. If it travels into your body, then pyrogen, baptisia, belladonna, lachesis, echinacea are great whole body infection remedies. And that happens a lot. People get MRSA, then they have to have their organs amputated, their limbs amputated. It's been terrible the last several decades in hospitals. You go there to fix your health, you catch MRSA from the hospital, and before you know it, you've got gangrene. Save those limbs and take pyrogen, baptisia, depending on the symptoms. Lachesis, if it's purple. If you have a dusky complexion and delirious and feverish, pyrogen and baptisia are your friends. Echinacea is great. Yep.
So if there is, after post-surgery, suppose if someone gets sepsis and because the person is hospitalized, he'll be already on an antibiotic protocol. The patient can take the antibiotics and then can try one of these remedies, like he can take belladonna if he has.
Absolutely.
Prevent further, means he has sepsis, so he is already taking antibiotic. Yes. But you want homeopathic remedy so that it will heal faster. Yes. So this belladonna and that antibiotic, they won't interfere, right?
No react. It'll only increase the vital force to kick out the infection, the whole body infection.
Okay, thank you.
And gunpowder is fantastic, especially for skin infections, wounds, diabetic wounds, neuropathy wounds. Why didn't I think of this before, Renee? My mind, I tell you. But get it and keep it on hand if you have a diabetic person on hand or if there's any kind of neuropathy. Gunpowder is worth its weight in gold when nothing else works. All righty. Then, yep. Any questions?
I have one more question. So regarding the eye, if someone is undergoing any retinal damage surgery, so is there any homeopathic remedy for that which the person can take pre, post? How is it? Any protocol for that?
Aconite, fantastic for eye surgery.
Okay, thank you.
So after you're done having surgery, 24 hours have gone by. You were woozy, you were in pain. You took your arnica or hypericum or chamomilla, as the case might be, for the pain. You took phosphorus or nux moscata for the anesthesia. You might take polyantibiotics or polyanesthesia to recuperate from the immediate effects of the surgery. And now, 3-4 days went by, and now you're in the recuperation phase, which is 10 to 15 days out, all the way to 10 years. And your goal here is to prevent adhesions so that your body can operate optimally. to prevent damage and adhesions in your ligaments and fibrous tissue, to prevent blood loss or the effects of blood loss, blood clots from the drugs in the hospital or from the surgery or what have you, and get your stamina back. For that, thiocyanamide, for adhesions in particular, thiocyanamide, graphitis, again, I have misspelled it, graphitis, oh no, that's correct, sorry. Natrum silicatum, etc., are good for preventing and dealing with adhesions. For your ligament and fibrous tissues, injuries, pain, rust in meniscus surgery. A lot of people have meniscus surgery. Rust tox is great. Kali iode is great. If you have great blood loss, then China, ferrum phos, tamarind, melilotus, there are many good remedies for blood loss. If you have blood clots, especially if you had a COVID vaccine and went in for surgery, let me tell you, the blood clots are killing people. Vipera berus, take not homeopathic, but nattokinase, the enzyme, serrapeptase, the enzyme is a blood clot buster. Especially if you've had COVID vaccines and you're going in for surgery. We have a lot of relatives and friends who have that situation. To get your stamina back, use the different cell salts. There are 12 cell salts. Use them 3-4 times a day. Cal-phos for bones, ferrum phos for anemia, nat-phos for digestive issues, and so on. It'll really help you heal. It'll help you heal. Put them in your water bottle or what have you.
What is stamina back?
Stamina back means your strength back, your vital force back, your ability to deal with it, to assimilate the damage that was done and to heal from it.
Got it.
Your strength back.
Thank you.
There are some things that carry on in the recuperation stage. For instance, bunion surgery, very slow and low. You want calfluor, ruta, and bryonia if you had bunion surgery. These are things that are been in your body for a long time, are harder to deal with the after effects of, or slow growing tumors, bunions, cataracts. So these are the kinds of things. Cataract surgery, you need calfluor high and aconite high for the recuperation phase. If you have bladder surgery and you have kidney weakness, you can have serum anguillate, eel serum, and tincture form, 5 drops twice a day or something like that until you feel better. If you have collapse after surgery, especially musculoskeletal surgery, strontium carb is your friend. Take it frequently. If you're weaning off of pain meds, Nux vomica is great for weaning off of addictive pain meds. Ammonium valerianicum is wonderful also.
For aconitum and calfluor for surgical cataract treatment.
Cataract.
I have a condition where I had cataract removal on one eye, but a present cataract on the other eye.
Mm-hmm.
If I take it, will that affect both, or one or the other?
It will affect both eyes, but if you have a cataract, calfluor will help. After surgery, calfluor will help, and aconite for the effects of the surgery will help both eyes.
So that's pretty close to the surgical time, right?
Yes.
Got it. Okay.
Yes. Another practical tip is write it down. You're not going to remember. I'm not going to remember. I might be in Goa, so you cannot get you may not be able to get a hold of me or your friend or your homeopath. Write it all down. Think about your surgery. Think about what you actually need and don't need, and look through the remedies and say, yeah, I might get nerve, and be calm. Don't get overwhelmed. It's only a handful of remedies, guys. It's literally, we did about 20-30 remedies, of which you're going to need 4 or 5 tops. And once you think about it, write it down and get yourself a few bottles that resemble water bottles so that nobody asks you questions at the hospital. What are you spraying, or what is that dark glass bottle? Keep it in plastic bottles that look like your crystal geyser or something, and keep 5 bottles on hand. Do not put them in the hospital refrigerator. They'll disappear and someone else will drink your remedies. And plan so that you don't get overwhelmed, and plan it out with your caregiver. Tell them, if this happens, give me this. If I'm woozy and nauseous, give me phosphorus. If I'm comatose, give me Nux moscata. And they will know, because they're not dummies. They care about you, and it's simple. So 2 or 3 or 4 things. Create a check-in time with the person who's helping you, your buddy, your homeopath, and limit your time to small time frames frequently. So 4 hours since surgery, this is happening to me, what should I do? It's now 20 hours since surgery, this is what's happening to me, what should I do? Like that. And that's a good thing, because it will allow your caregiver to think through, or your homeopath to think through, and not waste your time and theirs, because you're tired and they may not be available for long stretches of time. Also, take care of your caregiver by giving them cocculus, ignatia. They're going to be stressed out. They're going to be sad if you're in an accident and in a hospital. So you should always have something for your caregiver in your kit. And the fridge is a bad place. And keep it in jars and bottles that are not easily identifiable as homeopathics. The fewer questions you have to answer, the better.
So how do you do that if you want to know which is in which bottle, but you don't want to write the words on it? What do you do?
Oh, just put a mark on it, little blue tape, just in a corner or on the lid or on the side where it's not noticeable.
Okay.
Or you can even tape it and just tell them, hey, it's my water, which is special water, and it's blessed by my priest or whatever.
Got it.
Sushma, should any of the bottles be like dark bottles rather than clear glass?
Ideally, you want dark bottles that are glass, but be practical. You're only going to be in the hospital for 1 or 2 or a few days. It will not kill you to have plastic bottles. They're easy to carry, easy for your caregiver to give you, easy for you to pop open and drink from, So I would say just keep 7 or 8 bottles filled with each remedy. Get the tiny, tiny water bottles, the ones that are a few ounces, 2-3 ounces. And just say, hey, I want water. And the caregiver will give you that water and you chug it. And you can leave it on your counter, on your table, without risking the nurses and doctors asking you 20 questions.
What if we pop in those homeopathic pills directly?
Oh, you can do that too. Sure.
What was that question? I didn't catch that.
Well, how about popping the pills directly? One of the objections to that is you may not be properly awake, you might be in pain, it might be hard. So you just, on the other hand, you just open the lip and pop in a pill, which is for comatose people, that is great. Or take a wet soaked cotton rag and a cotton ball and put it on the inner cheek. That's good too. Whatever works. And that is that. If you don't have any questions, I'm gonna stop recording so that we have a decent recording and you can refer to it at all times. Thank you all. And that was surgery, practical prep homeopathically for your surgery and how to think about surgical procedures.